Go.
Great. So welcome everybody. It's the Tuesday, September 17th Advisory Board of Health meeting, regular meeting, 7 p.m. Town Hall Room 119. We have a full boat here. First order of business is to approve the meeting minutes from June 18th, 2019, which were sent out previously and have been posted up online.
Yes, it's drafts.
Mac for move. Anybody second?
I'll second.
Christine. Everybody, great, thank you.
Yep.
First order of business is a report from the Director of Health.
We're going to go through this quickly tonight. We finally got flu vaccine late last week. They're running their formulations late this year. And we immediately set up our clinics. They're going to be, I included the schedule along with with the minutes that I sent out, or the notes that I sent out, and they're going to be online, and we'll be circulating it to the media.
How many doses did you do?
Well, so far we've gotten, I don't know, maybe 50.
How many?
But that's good enough to get started. I think we ordered 350.
We have how many did you say?
350, I think, is what we ordered.
Mm-hmm.
And so far we've gotten 50, but that's good enough for us to at least get started and offer it on the scheduler.
Right.
And offer our first clinic at the senior center. We're expecting more every couple of weeks.
Are these high dose or both?
Both. We get preservative free for all our vaccine, and it's about 2-to-1 regular to high dose. Last year the only vaccine we had left over was high dose.
Did they change the formulation?
Yes, they change it every year. And they waited a little later this year because last year's flu, if you remember, was hitting pretty late.
Yeah.
So it was evolving. So they were kind of waiting to see what it was going to look like. And then they kind of roll the dice and see what happens, see how good it's going to be. And they don't know in advance what's going to be the next flu. And the later it is, the harder it is to predict. And last year's flu, didn't start until after the New Year.
Yeah, and I just had this conversation with the doctor at Yale this past week, and they don't like to give it too early.
Right.
The flu vaccines, they do want to wait a little bit so that they can catch if there is, a problem, that they'll be able to catch it, and it often happens, like you say, a little bit later on.
Right.
So it's not bad getting it a little bit later.
Yeah, it seems, with the colder weather coming later, the flu itself is coming later. I'm pleased to report under HeartSafe Community Update that we just had I was called by a member of the media to ask if we had a map that showed where AED locations in Darien were. And we don't. We have an inventory, but we didn't have a map. So I checked with Planning and Zoning because they have the GIS mapping system, and I asked if they could put it together for us, and they did. They said yes, and they did. So it's on our website now. It's really pretty cool because the first time I looked at it, I used my phone, and you could even tell where these locations are through the phone,
Okay.
through our website.
Approximately how many do we have in Darien?
Yeah, there were like 60 sites.
Wow.
50?
60, between 50 and 60, plus the police cars and the post 53.
Right.
So yeah, we're well over the minimum standards needed to be a HeartSafe community. We knew that before, but this really confirms it even more. We're pretty excited also to announce the upcoming vaping session that's going to be at the library toward the end of October. I included a poster. We're partnering with Stanford Health and putting together a pulmonologist, a pediatrician, and our own James Palmieri who's been the student resource officer, to talk about vaping. And with all of the news it's been getting lately, we're hoping it's a very timely event. And we're working with the Thriving Youth Task Force to promote it. We're thinking about trying to do some buybacks, perhaps, having kids that come maybe getting gift certificates, try to put together some fundraising to actually not just talk about this problem, but do something about it.
Mm-hmm.
You know, and we're kicking around ideas with Thriving Youth and, to see what we can actually do as a community, other than talk. So
Yeah, and do these kids, I know the teens and the parents, if they're meeting together in a group, is there any opportunity for these teens to be able to talk to people that are not in front of their parents? You know, like, will there be people there where they can just...
this is a library presentation, so
Yeah,
it's
just a
over at a certain
presentation.
period of time.
Okay,
And, you know, we can take that under advisement to say, okay, here's a resource for you to check with, you know, for if you want to talk with somebody later on, confidentially, yeah. And it's interesting because I was listening to a member of the New Canaan Police Department discussing vaping the other day, and I guess they took a vaping device from one of the school kids in Canaan, and they called the parents in, and the mother said, "Oh, that's not for vaping. That's a laser pointer." And it wasn't the laser pointer, but she thought it was because that's what
Johnny told her.
Johnny told her. Johnny doesn't want it. So anyway, we're pretty excited about that and hope to get a big turnout. And again, we're doing farmers market. Next week will be our fourth time this year. Free blood pressure screening and public health information dissemination. We'll be promoting that event at the farmers market too. We think it's good to have some visibility in the community. You know, as much as we can get. Moving on to seasonal programs, beach report, West Nile virus. We just got the first phone call from the State Health Department about our first positive pool of West Nile virus mosquitoes on September 11th. Yeah, no coincidence to that, but that's the first one of the year, which is really late. I don't think we've ever had a positive report for West Nile that way, or as late as this. And I don't know what to attribute it to, and it's pretty consistent statewide. There just haven't been as much West Nile activity as there has been the Triple E, which has been making the news this year. No one in town has, you know, we've not had any cases, knock on wood, of West Nile disease in town, or in Connecticut residents thus far this year. So that's the good news. As far as the beaches are concerned this year, we, again, never closed the beaches due to high bacteria counts, but we did close after more than 2-inch rainfalls. That's a substantial amount of rain. We had some pretty good downpours in July. So we proactively will close the beaches after a heavy rainfall because we've established in the past when it rains a lot, the bacteria counts are high. We use a rain gauge at Pear Tree Point, so we have a very close by indication of what the rainfall amounts are. Continuing along, we've done a lot of tick testing, and what we found this year is it's been a lot of dog ticks. We had positive amounts early in the season, and as the summer kind of went on, the numbers of ticks being submitted for testing has declined. But anytime we find positives, we contact people who've submitted the ticks, and people are complimenting, because Paula sends out the notices, and you know, people are very happy to hear from us when we have something extra to add. And generally all we're adding is to say, just want to make sure you got this information, and you know, letting you know maybe you should check with your doctor. Pools were all inspected this summer, generally every other week, and consistently found that pH and chlorine levels were you know, pretty good. Filter systems are working. We haven't found pools to be an issue in town or a problem. Food protection program, we're staying staying current and up to date with our inspection frequency. It helps that our facilities are doing pretty well too. You know, they're not having a lot of repeat inspections or re-inspections due to failures. There's always some, but it's been pretty good lately. Another thing I've been interested in seeing is that we've been watching and being able to recently, in the past year or so, we've been able to track viewings of the website ratings, where the ratings are. And in August, we had 177 hits on the ratings viewing website, which is a lot. That's a lot more than we've ever had. I think the most we ever had before was like about 120. I don't know why. I think maybe there was something in the news about what was going on in the rest of the state, and people were kind of curious because we're one of the very few jurisdictions that not only post ratings, but also the full inspection report. And I know nobody else publishes inspection reports from our cosmetology salons. So we're the only ones in the state that do that.
Yeah, I read an inspection report for one of the restaurants. It was very revealing. I mean, there's definitely the letter grade, but then you look at what supports the letter grade, and you can definitely...
Yeah, it's nice to have that comprehensive view. I mean, the letter grade is, like I said, it is what it is, but...
I mean, definitely, I'm not an expert at food inspections, but it concerned me, the stuff that I read in the report.
I wish more people read them,
Well, I think-
especially when it's a C.
Yeah, and I think that was a really good raising the awareness when they had that I read recently about some of the restaurants here and elsewhere. I think that's really good that people are becoming more conscious about where they go to eat and how the food is prepared and the environmental conditions there, and that's great.
It was great to see how well the schools did, in terms of those cafeterias.
Years ago, we came up with a plan that was called the Letters of Commendation, and we stopped doing that when we had staff turnover and some issues with staffing, and we weren't able to maintain a frequency of inspections that I felt comfortable with. But I'd like to do that again, and I will tell you, consistently, the schools all deserve letters of commendation because they really do very well all the time. Yeah, I'm pleased to say that too. All our seasonal food service operations at the beaches, at the country clubs, the golf courses, out in the links, pools, are all inspected this summer. Just another little sidebar thing that we do. Mindy is representing the department at the FDA Northeast Regional Conference on Food Protection, which is really I'm very happy that she's able to go because with the perhaps soon to be adopted FDA food code, this is going to be going a long way to helping us understand what we need to do in going into that. And she's also she's been really involved in several different statewide initiatives. Food, call this a FIDO, a Food Instruction Training Officer, so it'll enable her to certify local health officials in conducting food and service inspections under the FDA food code. So that's another level of expertise that the department
David,
will
the
have.
FDA food code, is that what you've been waiting for at the
Yep.
state level?
Yes.
For them to
Implement.
implement?
They've passed the law, I think it's probably almost 2 years ago,
Right.
but they still haven't gotten the regulations through the Attorney General's office or the Governor's office or wherever they're saying that the regulations are stuck right now. The newest statute delayed it until January 1, but my confidence level on that date isn't particularly high. That's why I say there's no word on the implementation date. There's a target date, but there hasn't been any real training in the use of the inspection form, which I think would be kind of like a prerequisite. But
Well, thankfully your department's not doing nothing while waiting for this.
that's exactly
Yeah.
why she's off at training right now and why she's been
Yeah.
going for this extra FIDO training program and why we're also working with other departments, anticipating the change in the code so that we'll be ready to maintain the ratings, which I think are so important, because once we do to the FDA food code, as I've said to you many times, there will be no score at the end of the inspection report. There's no numerical score. Now there's a 90 or 95 or an 88 or something like that. On the FDA code, no score. So we have to figure out a means of matrix, which is what we're working on, to create a rating without a score. Because right now the score, the rating obviously is correlated to a large degree to the score itself. This is a little tricky. Any other questions on the food program at this point?
That's good.
Thank you. Cosmetology and salon safety program, our annual permit renewals are underway right now. We inspect the salons twice a year and once upon permit renewal, so that's part of what we're doing right now. And again, Mindy is co-chair of a statewide work group charged with developing inspection guidelines for cosmetology salons for local health departments in Connecticut, because the state, there's no state standards or regulations in effect. So the legislature passed statute this past session that required that this be done, saying that we needed some guidelines, statewide guidelines, and a state licensing program for nail techs, eyelash technicians, and estheticians. So we've tried to be part of and help draft the guidelines for that. Not all health departments in Connecticut have been inspecting these facilities, believe it or not, but we've been doing it all along. So, and Mindy's very good at it, and so she's been helping out a lot with the statewide development of these regulations. Emergency preparedness. Favorite topic, right? We're doing a comprehensive review of our current preparedness plan. Having a new set of eyes with Nick, I think, is going to be really helpful for us to do that. And in part, what we're doing is to reassess the pods and dispensing systems that we've established, the main one being at the high school, with a secondary dispensing location in the Mather Center. Going through security analysis of the town hall building in that regard has been really interesting, and the police department's been very helpful in doing that.
The town hall building or the... Oh, for the method. Okay, got it.
Both.
Got it. Yeah. Okay.
Both, you know, I have a copy of the town hall security. I kind of cut and pasted a report from Stanford Hospital with the Community Health Needs Assessment Report, where it describes the process that the hospital has gone through to develop a needs assessment for the service area, which includes Darien. Data analysis. There's a reference to the needs assessment on the website for the Stanford Health. But a summary, mortality rates have declined in both Stanford and Darien in recent years.
Mortality rates or premature mortality?
I'm reading directly,
Oh, okay.
so I don't know how to interpret that.
Okay.
And I don't know that he does say that. In the meat of the report, I'm sure that gets into it. But this is his summary just states that mortality rates declined in both Stanford and Darien between 2010 and 14 as the previous 5-year period.
Probably because a lot of the elderly people have moved out and leaving a younger generation. Younger people?
Well, the next bullet point says the number of older individuals living in Fairfield County has grown
Now we're
considerably.
growing. Okay.
And the growth of the 65 plus cohort is expected to continue.
We'll explain. Okay.
So, I don't know, You have to keep in mind that the data they're using combines both Stanford and Darien, so it might be skewed a bit. But they did, because we were part of the discussion, they did keep the needs of our community in mind. And then kind of a significant one is the average life expectancy of residents of both Darien and Stanford is higher than the average life expectancy observed across the country and in Connecticut. The three issues that have emerged in the study, no surprise to anyone here, I think, is number one in both Stanford and Darien is behavioral health. And lumped into that, we talked is just basic mental health concerns and substance use disorders under behavioral health. So the next piece of this work would be that we'll be working to develop a plan to address those priorities, with the number one need here being behavioral health. We've talked to the hospital about instituting a more aggressive program of recovery coaches for folks that present for substance use disorders, because the data show that when there's a recovery coach there, when somebody presents at the hospital, that chances of recovery or treatment are much higher than if they're just discharged. A significant finding with respect to just data with respect to the substance use issue is that when I look at and review the syndromic surveillance system that the state has that show why people go to the emergency room, we have a ratio of about 5-to-1 of alcohol over any kind of a drug overdose presentation at hospitals. And the drug overdoses, half of those are poisonings accidentally. So I don't want to discount the fact that, we don't have a drug problem in town. But by far more people are presenting at hospitals with alcohol issues here in town than because of drug misuse or drug abuse.
So did they give an age breakdown of that?
Yep, I could see the whole age group. It's everybody.
Yeah. Are we doing anything now, especially for the youth and the high school students related to alcohol use, which seems to be quite prevalent in town? For teenagers anyway, all over.
So for any, I think, correct me if I'm wrong, David, but if you're going to do a sport or a club, which I think covers just about every student, right? It is mandatory that you go through a drug and alcohol education program, right? So just a couple weeks ago, I was out there with my son, and they had some administrators, some counselors, and the youth bureau police officer there, and they did a fantastic job. Okay. It was awesome. PowerPoint, panel, talk, discussion was really, really great.
Okay, but as we all know, I mean, education is great, but how that is operationalized, I mean, in a child, in a teenager, I mean, because I think most kids go out and test limits and drink, somehow they get it. Is there any other kind of a thing that we can do to help these kids, or to be able to go to a trusting adult, maybe not their parent, or if they're having a problem, or underlying some of the alcohol use? Do we have, and that's related to mental health, do we have something here in town that would be confidential, anonymous, or not to go and call their parents if they want to just confide in another adult? Is there something we have in place here?
There's nothing free. I mean, there's all kinds of services for counseling services, but as far as just there being somebody to call for some free assistance, I don't know where that would be anywhere.
Or a helpline or something?
Well, there's those, but I don't know, in terms of there being meaningful follow-through on things like, because that's what you need. I mean,
Yeah,
it's
so
just
yeah.
not a one-off.
And just not for alcohol, but for other substances or for understanding more and, preventing STDs or other pregnancies or other kinds of things. Are we
You're
doing
talking
that?
about a school curriculum, and that's something that the Board of Ed needs to look at.
Yeah, the Board of Ed would be great, or even outside the Board of Ed, if there's some place or some people that the kids could talk to. Like
Well,
you
I know
say,
the depot is very active and
the
things like
depot,
that.
Yeah,
That's
great,
true.
okay.
And,
true.
Yeah.
But and I think that's kind of unique to this town, to have that resource. The work that they do is phenomenal.
Yeah. Well, maybe the Board of Ed might be a good place to
Well,
try to get through.
if you're talking about education and having counseling, and they do
Yeah.
have counseling
Yeah.
through
Yeah.
the schools.
Right.
Now, do the kids want to talk to the kids at school, to people at school? I don't know if the kids want to talk to anyone. Really. I mean, there are those who might, but they're more likely to talk to their friends.
Well,
not
yeah. Or if it's kept confidential and not the information not given to the principal or the teachers or
Yeah.
anything like that. I mean, that would be important.
I'm not sure where you'd find that. Those kids that are interested in finding somebody will, I think.
I mean, that's what we do. I mean, we're subcontractors where I work with the Board of Education coming out of the Post-Traumatic Stress Center. So we do kind of brief counseling, 15 minutes at a time. If a kid just wants to talk, get something off their chest, or if there is some kind of a problem or issue, then we're actually separate from the school. But
Okay,
we
but
go
who
in.
pays? Who pays?
We get through some from the Community Foundation, okay, some private grants, and so yeah, some of it's pro bono, because our for-profit arm, we have the clinic post-traumatic stress, and what we go through is the Foundation for the Arts and Trauma, basically, trying to be creative and get the kids to be able to get some help for themselves.
I know our school SROs are really involved with the kids too.
That is true.
I'm sorry, what was that?
The
School resource officers.
Oh, yes, that's right.
My understanding is that they're, kids really respect them for the most part, I mean, there's always gonna be those who
Right,
don't
right.
want any part of it, but.
Yeah, because like you say, with the people going into the hospital 5 to 1, being presented through the needs assessment for alcohol use disorders, probably a lot of adults, but this will start, when they're
Well,
younger, so we
well,
want to prevent that.
Yeah, I know, by that time it's a problem, but you
Right.
still need to have the hospital, and that's part of what we're gonna work on
Yeah,
at the hospital is to
yeah.
develop those kinds of programs. That's
right,
part
yeah,
of their
yeah.
community needs
Yeah,
assessment plan.
definitely.
So
yes,
that's, we're gonna tease that
Yeah.
out more.
that's good.
So we've been actively involved and we will continue to be actively involved in that program with the hospital and the community needs assessment. I did want to get back to you on a couple questions that were asked last meeting. We're not going to be able to be at St. Luke's.
Oh, do I?
We just don't have the staff for it.
Or the resources,
Nobody's available.
The staff, okay.
And we have not received a single phone call regarding dogs at the beach. Just want to throw that out there, with respect to the concerns about the problem with dogs at the beach since our last meeting.
Yeah, I think something ought to be done about that.
Well, I mean, if we don't know that there's a problem and people aren't calling to say that there is, we can't do anything.
Right.
With that, I conclude my report, unless there's some questions or comments from anybody.
Two things. If you can think of any way that this board can help you, please let us know. You always know that emergency preparedness is my bag. So when I saw we're having a drill, I'm in. You don't have to tell me when it is. I'm in.
Mm-hmm.
Or help you or Nick do the review.
Great, thanks.
And just as a reminder, I believe the next meeting is Tuesday, December 17th. I will put that in the minutes to distribute to you all. I don't have it in my calendar, but if you go by the third, I think it's the third Tuesday of the month, that's the 17th, so I will confirm with that.
Okay,
That's
excellent.
great, thank you.
Anything else?
No, it's great.
Can I get a motion to adjourn?
Yes.
Jennifer. All great, thank you.
Okay.
Great,
Record time.
Thank you, yeah.
It is.
brilliant.
Thank you.
Half an hour.